I'm Dr. Linda Gromko. This is Transgender Medicine Made Simple. Today's topic, facial and body hair can present roadblocks for transgender women and others as well. So why is it such a problem? First of all, hair on the face and on the body read male. It grows continuously, and some people really have to shave twice a day to make it not visible to other people. And the third thing is that there's just so much hair. This picture on the right shows this individual with the hair really grown out, but when you think about one hair per pore, it's hundreds, maybe even over 1,000 hairs in a human face. It must be removed before gender-affirming genital surgery as well as facial feminization surgery. What kinds of hair removal are available? Well, there are two basic categories. We have the temporary methods. We'll talk about those in a minute, but those are sugaring, waxing, and tweezing, and these are not available for pre-surgical clearing. The more permanent methods, however, are laser hair removal, electrolysis hair removal, and these can be used as pre-surgical clearing. So let's go into a little bit more detail on each of these methods. So we have sugaring, shaving, and tweezing. In the picture at the left, you can see that somebody is applying a honey-colored paste onto a person's skin. And when that is set, this is ripped off and the hair comes off. And it's really not too painful, but it's something that can be done. And it's very effective, but only on a temporary basis. That hair grows back. Then, of course, at the right, we have shaving, and then finally, we have tweezing. These are all very common methods, but again, they're temporary. Now we have threading and mechanical removal. Let's look at this a bit. In the picture on the upper right, you can see a woman having her eyebrows threaded. And this is an Indian technique, East Indian technique, where people use this elaborate pattern of thread weaving, I guess it is, and they remove the hair. I understand that it is painful, but it's very effective, and people do it quite commonly. In fact, you can see little shops for threading even in the shopping malls these days. Below in the slide, there are two pictures of an epilator. Now, an epilator is something that you pass along the skin, and it basically pulls out the hairs. In the slide at the lower center, you can probably see, if you focus in, that there's lots of little areas the hair is pulled in, and it tugs the hair in and pulls it out. I don't think that this stuff can be comfortable at all, but at least it's a method. Now, let's turn to the more permanent methods. These are laser and electrolysis hair removal. The picture at the right is our laser machine at work. This is a Vectus laser, and it's basically designed just for hair removal. This machine works on brown and black hair only. All lasers are going to work just on brown and black hair. So if you have hair that's gray or white or blonde or red or some combination of this, you're kind of out of luck with the laser department. Now, it's not uncommon for people to have some of their hair removed by laser, because many people will have a mix that includes brown and gray or other colors like that. Laser can take care of the one color, but it cannot take care of the lighter colors. In laser, we direct a light of a single wavelength to target the melanin at the base of each hair follicle, but you do it in a range. Like, for example, if you take the head of the laser and place it over the skin area, that is the area of hairs that will be attacked. So there are many hairs within that surface area. This method treats only the hairs in the growth phase, and there are 3 basic growth phases to hair growth. So you have to have several treatments. We figure that 7 to 8 treatments done about 6 weeks apart will do a reasonably good job for most people, but not all.